On your website, it says that you travel to other countries and witness other alternative therapies that aren't allowed currently in this country. What have you seen in some of those other countries in your experiences that have been successful in treating cancer that's maybe not available here yet?
Well, I have traveled to other countries to use drugs myself. And on my website, there was a patient who was end stage with small cell lung cancer, and I think he had a few weeks left to live. And I used a drug that is not approved in this country, and we actually got complete remission. As far as what I think is out there now, do I think there's the Holy Grail in some other country? I do not. I will applaud Germany for commonly using integrative techniques, meaning when you get treated for cancer in Germany, it's very common to get all the traditional therapies and all the conventional chemotherapy, but along with a lot of complementary techniques. And that's the case often in Asia and South America as well. Having said that, I have not been to a country that has the Holy Grail to cure cancer.
Using Germany, as you mentioned as an example, why isn't that treatment philosophy more widespread here?
Well, you know, I have to say, from all the places I've traveled, you know, the United States tends to be the most narrow-minded, the most closed-minded with regards to alternative techniques. You know, why is it the case? You know, when you get trained in this country, you know, certainly, and I realize the pharmaceutical industry is a very, very powerful industry worldwide, but it seems to be more powerful in its dogma, at least, in the United States. And I'm actually residency trained and was board certified in emergency medicine. And everything we learn really does come down from the pharmaceutical industry. So if you were to do things that was not basically taught from the pharmaceutical industry, it's considered heresy here in the United States. I wish I could answer your question and say, why are we more closed-minded here in the U.S. Than elsewhere? And I don't think I have the answer to that.
It's unfortunate where a lot of people think they have to look outside the country to get a treatment option that might fit them better than what they can get here, isn't it?
It is, and you know, as a matter of fact, I'm meeting with Senator Rand Paul next week because he read a letter that I had written, and it was exactly that. I had taken a patient who was terminal out of the country, and we got complete remission, but that treatment would not be allowed here. And one of the things I'm speaking to him about is there is a law called the Right to Try law, which says that if you are terminal, you have a right, you and your physician have a right to try any drug, but that's really, the right to try is in name only, because it still requires that the drug passed a phase 1 clinical trial, which of course is funded by a pharmaceutical company because nobody else can afford it. And it's got to be approved by an oncologist who's an FDA advisor. So the right to try clause really eliminates individuals from really trying novel techniques, even when they are in fact terminal.